One of the most common questions that I'm asked as a laryngologist or voice specialist is in regards to patients who come to see me who notice that one side of their voice box is not working as well as the other. That could be due to many different problems, but basically one side is just not moving as well. And so a lot of questions arise from that. When is it going to get better? How can I tell if it will get better? What can be done in the meantime? And what does this mean for me long term? We provide specialized electrical testing of the muscles to determine the prognosis, as well as providing both surgical options for treatment, as well as temporary options, which include in-office procedures to hold you over until we decide whether or not you need a surgery.
Oftentimes, patients will come in, patients and family members will talk to me about rhinoplasty, and I really have a significant amount of patients that come in to talk about revision rhinoplasty and nasal congestion. It's a common clinical scenario. Patients get rhinoplasties performed, and after the rhinoplasty, they can't breathe. So that's when they come to me. As an ENT and a facial plastic surgeon, oftentimes I'm able to fix the inside of the nose and the outside to optimize their breathing and their aesthetic profile.
People always ask about bleeding. You know, you have this, I mean, the majority of us out there usually get nosebleed. How do you control it and how do you stop it from coming back? As a physician who deals with that on a daily basis, it's something that's really basic, that could be very basic, and to us it's always not a big deal. We're just going, we cauterize it. It's always interesting when you talk to patients to see how much those things can affect them. I mean, I've had patients who just decide they would not go out and eat with their families because they don't want to go out there and start bleeding at a restaurant.
One of the common questions people ask is, what's the difference between an acute sinus infection and a chronic sinus infection? An acute sinus infection is what it sounds like. It's acute, which means it's short-term. It usually happens after a patient has a cold-like symptoms, which are usually viral. So it starts off as a viral infection, which gets better after 5 or 7 days. But once they hit the 5 or 7 day mark, suddenly their symptoms get worse again. And that's a sign that you're getting an acute sinus infection or a bacterial infection. And so at that point, it's recommended to start antibiotics. And you should try and hold off on antibiotics for those first 7 days, even though it can be difficult. But it's important to do and wait until that 7 day mark and you've really showed signs of an acute sinus infection. Chronic sinusitis is actually a different entity entirely. It involves both subjective and objective findings. The subjective findings are headache and facial pain, loss of sense of smell, drainage from the nose, either through the front of the nose or in the back, and nasal congestion. This has to happen for at least 12 weeks to be considered a chronic sinus infection.
RWJBarnabas Health. Let's be healthy together.